Good morning or afternoon, everybody. We'll be getting started in just a couple moments. Let folks continue to log in. Folks, we'll give it one more minute as people continue to log on. It started to slow down a bit, but let's give it one more minute. Okay, we're at 2:03, so why don't we go ahead and get started. Again, good morning or afternoon, depending upon where you are. I'm Dane Collins here in Atlanta, and welcome to the DIS Workforce Supplement Evaluation Summary Webinar. A couple of housekeeping issues, if you will, before we get started. This is being recorded, and a link to the recording and a copy of the slides will be sent out hopefully within the next several days. We're going to ask that you hold your questions. Well, don't have to hold them. Put your questions, if you would, in the chat, and at the end of the presentation, we will come back to those questions and provide answers. And if you aren't speaking, please make sure your microphone is muted. And before we get into the presentation today, I want to take a moment and briefly introduce the new branch chief for the Program Development and Evaluation branch, Dr. Stanley Way. Stan, are you on? Desita, if you're there, I'm not sure if you have everybody muted from your control. I'm looking to unmute for Dr. Way, WEI.
Yes, hello.
Oh, hi, Stan. You want to take a minute and introduce yourself to the recipients?
Sure, yeah, happy to. So I'm Stanley Way. I'm a new branch chief for the Program Development and Evaluation branch at CDC in the Division of STD Prevention. And I guess just a little bit about my background. I'm a physician by training in internal medicine, and I do have experience working in the field. I at different times worked in one of the Atlanta Metro Health Departments, and also did 6 years in the field in Mozambique. So I do kind of come from a perspective of being on the other side where you get guidance kind of from Washington or from Atlanta about different things that you need to report. Sometimes it doesn't always make sense. So one of the things that I want to encourage is open communication between the state and local health departments and CDC, so that you're telling us, if we're asking things of you that are too much or don't make sense, or we could be doing better. My last 14 years, I worked in HIV, first domestically and then abroad in PEPFAR, and then now coming to this position. So I look forward to working with you all more in the future. Thanks.
Thanks, Dan, and welcome to the division. We're excited to have you. And my colleague Tosin Ario is going to help me present today. We're going to kind of hand off throughout the presentation. Tosin, are you on?
Hi, Dane. I'm here.
Great. All right, let's get started then.
All
Again,
right.
this is DIS Workforce Supplement Evaluation Summary Webinar. And my controls don't seem to be working here. Oh, there it goes. It's just slow to react. So a recap of the DIS Workforce Evaluation data submission that you all lived through. For this reporting period, all project areas submitted a report for the analysis, so 100%. 81% of the project areas submitted a report on time, which was an increase from 58% in the report period ending June of 2022. So that was good to see. And as a reminder, the data was due March 31st of this year. And again, the reporting period cover was July 1st of 2022 through December 31st, 2022. Need to mention some data quality concerns, just so we're all aware that some of this data should be interpreted with caution. This is a relatively new exercise, reporting on the DIS Workforce Supplement. So getting systems in place, collecting the data, being able to extract the data and put it in a form that can be reporting has been an ongoing effort. So some of this is expected, but we did run into some missing information, some inaccuracies in the data, and in a few cases, misinterpretation of the guidance or definitions. Throughout the process, we've tried to listen to your feedback and try to revise the template and the guidance document to be clearer and more useful to you. So today we're going to talk about progress by the 5 priority areas that make up the DIS Workforce Supplement, and these are all quite familiar to you. Priority A is establishing and expanding the core public health workforce. B is conducting workforce training and skills building. C is building organizational capacity for outbreak response. D, evaluation and continuously improve workforce hiring, training, and outbreak response. And priority E is health equity. That's really health equity in terms of working with the community, as well as diversity, equity, and inclusion within our workforce. So we'll start with priority area A, establishing and expanding the workforce. So for this reporting period, 69% of project areas conducted a workforce assessment since we began this effort in January of 2021. And that's an increase from 61% in the reporting period ending June of 2022. So again, nice to see the improvement. And here's a list of some of the approaches that many of you used in doing the assessment, looking at morbidity and disease distribution, interviews, listening sessions, assessment surveys, reviewing metrics, and reviewing areas of emerging disparities and health inequities. Some of the factors that affected why programs did not conduct a workforce assessment: short staffing, lack of time. Maybe they did informal assessments as opposed to what could be considered a more formal workforce assessment, or they were in progress. Again, different people are at different stages throughout a lot of this. So some were still in process with their workforce assessments. In terms of expanding the workforce, what worked well? And a lot of these, the qualitative data you'll see across all of these priority areas, some of it hasn't changed much over the 3 reporting cycles that you all have done. And that's to be expected. Again, different programs, different areas, and trying new things. But what worked well for expanding the workforce, promoting internal staff, obtaining input, garnering buy-in from current staff, really critical, and leadership to try to reduce the hiring hurdles, creating new positions and contracts, improvements in the hiring and recruitment processes, and training staff. Some of the challenges experienced include, so familiar to all of us, the lengthy hiring process, coupled with overburdened human resources, just the bureaucracy. Finding qualified applicants was cited by many. Training new staff, that takes time, and training resources. Competitive salary and promotion, that's also been reported by many as a challenge. And then, of course, delays in contracts. And so in terms of retaining the workforce, what are some of the things that worked well? Fair and competitive wages to keep people on board, providing opportunities for growth, doing some coaching. The remote and flexible work options has been a real benefit for many programs and keeping people on board. And just retaining the positions, the FTEs, has been critical. Challenges, again, some of the same challenges arise throughout this. Low salaries, departures or turnover, some staff burnout, especially coming out of COVID, a general lack of professional or development and training opportunities. And of course, again, COVID-19 right then into MPOX for many of you, and the responses and deployments to those. What were some of the innovative methods reported for expanding the workforce? Proactive and non-traditional recruitment strategies. Some people got really creative. The supportive, flexible, and remote work, again, was something new to most of us. Outreach to local colleges and universities. Where are you going to find the applicants? And workforce investment in growth, developing your staff. In terms of kind of where we are at the end of at the end of December 31st, 2022, the end of the reporting period. What's kind of the status of PCHD and DIS workforce funded positions? Well, 1,651 of the 3,888, or 43% of the total PCHD and DIS workforce funded positions are DIS workforce funded positions, so almost half. It's important to point out that this graphic here and the data we collect only looks at positions funded by PCHD and the DIS workforce funding. We don't look at positions funded locally or with state funds or through some other funding source, such as maybe Ryan White or things like that. 507 of the 802, or 63% of the total PCHD/DIS workforce positions that are vacant are DIS workforce positions. And there you see in the table a breakdown stratified by funding and the types of positions. Interestingly, 1 in 5 or more of the nation's DIS positions are vacant, regardless of position type or funding source. And this gives you a breakdown of all the positions that we categorized. And again, more than 20% were vacant as of the end of 2022. Among the 59 project areas, regardless of the funding source and inclusive of state and local employment, the DIS workforce staff had a high retention rate and low turnover rate. Again, this is national data, even though some of you expressed or provided data that it was a struggle for you nationally. The retention rate was right. The median was at 87%. The median turnover, that's the new hires, was 0. And the turnover rate for all positions, new hires and existing staff, was at 11%. So now we'll move on to priority B, conducting workforce training and skill building. And I'll hand it off to Tosin.
Thank you, Dane. All right, so looking at training and skills building, 64% of project areas conducted a training needs assessment between January 2021 and December 2022, and that represented about a 10% increase from the previous reporting period. And the 38 project areas that conducted a training needs assessment used one or more of the following approaches. So some project areas conducted their assessment based on discussions and meetings with their staff, doing gap analysis of existing training programs, using DIS work performance or their performance in existing trainings. And a few project areas did formal assessments with their regional prevention training centers. And in terms of methodology, most project areas use surveys to assess their staff training needs, and some used a combination of interviews or just interviews alone. Next slide. Next slide, please.
Yes, it's not advancing.
So
Hold on a second here. Maybe this closed captioning thing is freezing it. Nope, it appears to be.
and we're doing so well. All right, do you want to maybe go back and then see if it moves back?
I'm trying, and it's not. Let me stop sharing and restart sharing.
Okay.
Okay, there it goes.
Yay. All right. So still on training and skills building, about a third of project areas did not conduct the skills and training needs assessment. So previous slide, we talked about the project areas that conducted a training needs assessment, and this is talking about those that did not. And they did not due to one or more of the following reasons. So having limited capacity of available staff, having vacant staff positions, experiencing administrative delays, so including delays in hiring or in award appropriation, having limited time or resources, and some persistent issues from cybersecurity incident that has kind of carried over from the last reporting period. Next slide. All right, so a little over half of the 59 project areas developed a training and skills building plan, regardless of if they did a training needs assessment. And in regards to mentorship, project areas describe having one or more types of primarily informal mentorship, such as receiving guidance from senior staff, one-on-one mentoring with more experienced DIS, having on-the-job shadowing, through guidance from their supervisors, and through the coaching, so see this through the coaching for enhanced disease intervention skills program, and through mentorship from their peers. And to manage their training or skills building, 90% of the 59 project areas reported having a dedicated training manager for their program. So that would represent about a 2% increase from the previous reporting period. Next slide. All right, so in terms of what worked well to conduct workforce training and skills building in this reporting period, the top facilitators were similar to the previous reporting period, and they included mentoring and shadowing for DIS, having available training resources through CDC, NCSD, or through CDs, and having dedicated staff for training. And then some frequently mentioned facilitators that emerged in this reporting period were having experienced DIS to provide trainings or mentorship and evaluating DIS training and or their work performance. And then on the flip side of the most commonly cited challenges to conducting training and skills building, the first three are also similar to the previous reporting period. And they include having limited capacity to develop or manage trainings, unavailability of standardized or updated training curriculum from CDC, and limited DIS time to attend trainings. And the challenges that were new that emerged in this reporting period were high rates of staff turnover, as we kind of talked about in the previous priority area. And that affected the number of DIS needing trainings. It limits the number of experienced DIS who can train or mentor or serve as subject matter expertise. And it increases the DIS workload and limits time for training. Other challenges include coordinating training for staff at varying levels of onboarding or experience, and having competing priorities, so with outbreak or emerging diseases. Next slide. All right, so reporting on innovation to conduct workforce and training. Most project areas continue to optimize the utility of virtual platforms, such as using their Microsoft Teams and adding interactive components to their trainings. In this reporting period, one project area reported innovation in their ambassador program, and they described that as a form of mentorship where their program identifies a peer for new employees to approach with questions. Okay, and this chart shows the percentages of staff who have completed each type of training for the 5 specific areas that are shown on this slide. So please note that DIS staff includes DIS for STD or HIV, DIS supervisors, and other DIS staff supported by DIS and PICH funding, regardless of their hire dates. And so this means all staff who ever received any of these trainings. So for this reporting period, there were some increases in 3 of the 5 categories, starting from the top of the chart. So almost 3 out of 4 DIS staff had received training on passport to services, and that represents about a 6% increase from the previous reporting period. 60% of DIS staff had received training on cultural competency, and the proportion of DIS staff who have received cross-training for diseases other than STD increased by 6%. The proportion of DIS staff training health equity and outbreak response remained unchanged. That's about 49% and 40% respectively from the last reporting period. Okay. I'll hand it back to
Thank you, Tosin. Priority C, building organizational capacity for outbreak response. So during the project period, 92% of the project areas reported having at least one outbreak response plan in place. And here's a breakdown of the plans by disease. And of course, STD and HIV lead the pack at 81%, and then hepatitis and TB in the mid-30s. And then other than for HIV, less than half of the project areas have updated their outbreak response plans since the supplement launch in June of 2021. And there's a breakdown there, 42% have updated their STDs, and then 19 and 8 for viral hepatitis and TB respectively. 58% of the project areas reported that they had adequate capacity to respond to an outbreak, while actually almost 60%, so more than just some, about 60% of the project areas reported that they are either moderately or fully ready to lead a response to an infectious disease outbreak. And we were careful to make the distinction between being ready to lead an outbreak versus simply having capacity to respond to one. Some of the responses given for the lack of outbreak response capacity. Of course, resources, don't have the number of staff. Funding issues, sometimes there are strings attached to the funding that limit how you can utilize resources. Limited experience with a lot of new folks coming on board. Maybe they didn't have a firm grasp enough to really be able to fully contribute to the outbreak response. And then some had outdated outbreak response plans. And then again, some systems issues were a challenge. Backlog of labs and network security incident, particularly in two project areas. Innovative methods used, virtual partner services, using technology certainly has accelerated in the last 5 to 10 years. Additional surge capacity staff. Social media, again, the use of technology to reach populations. Automated data processes, the whole data modernization thing that is upon us was really helpful in terms of outbreak response capacity. And optimized dashboards. Again, technology. In terms of COVID, and we debated whether to continue to collect COVID data, but apparently in the last half of 2022, many of you were still deployed for COVID. There were 143 DIS deployed for an average of 107 hours each. The average number of DIS deployed was a little less than 2.5 for an average number of, again, 107 hours. And the range of DIS was anywhere from 0 to 39. So still active in COVID response. There were 245 DIS deployed through other program areas for outbreaks outside of the COVID pandemic for an average of 39 hours each. And so the average number of DIS deployed here was 4.2. 44% of the project areas reported outbreaks, and then 82% of those outbreaks reported were monkeypox. And that's right when we were in the throes of the Mpox outbreak. 24%, 13 of 54 project areas with outbreaks outside their program area described their data as low or poor quality. And some of the issues cited were reporting from local health departments being inconsistent. Sometimes they were educated guesses. Sometimes it reflected state STD-DIS deployment only and not local outbreak responses. Limited capacity of surveillance systems to capture the necessary data, and just incomplete data in general. In terms of outbreaks involving STD, HIV, TB, and hepatitis programs, several outbreaks involved at least 2 priority populations. And you see there, pretty good involvement. Of course, that adds up to more than 100% because more than one population certainly was involved in many of the outbreaks. But clearly, men who have sex with men and women at 76%, and then males with only female partners at 67%, pregnant females at 43%. For STD, HIV, and TB and viral hepatitis programs, project areas reported 42 outbreak investigations, which was up from 31 through June of 2022. You'll see here below in the horizontal bar chart, 40% involved syphilis. The breakdown there, 17% Mpox, 7% gonorrhea or disseminated gonococcal infection, and lo and behold, 2% with chlamydia. Of the 17 outbreaks involving syphilis, project areas reported 3,511 cases. 95% of those cases got initiated for follow-up, and 80% were interviewed. And here's our traditional cascade for partner services reported by the 17 areas, and the data here is very similar to what was reported in mid-June of last year. Total contacts solicited, 80% of those were initiated, 34% of those were tested, 19% of the contacts were newly diagnosed, and 94% of those cases were treated. So now we'll move on to priority D. Tosin.
Thank you, Dane. Next slide. All right. So in the last performance period, project areas described conducting at least one or a combination of the following types of evaluation. So mixed methods, process, outcome, formative, and or impact evaluations. And project areas also describe using evaluation approaches such as assessing their disease intervention matrix, implementing surveys, and assessing staff and fiscal needs. Next slide. So in terms of what worked well, there were several facilitators to evaluation that project areas reported, and these included eliciting feedback from staff, establishing collaborative work environments, implementing data dashboards, and monitoring their DIS outcomes, either in trainings or work evaluations. In contrast, project areas also experienced several challenges, mostly related to hiring and onboarding, and also having limited resources, including limited staff capacity. Next slide. And then in terms of continuous quality improvement, several factors contributed to CQI, and these included conducting routine quality assurance, modifying their data systems, and integrating quality assurance into guides and trainings. On the flip side, challenges such as those related to hiring and retention and having limited capacity were identified as barriers to continuous quality improvement. Next slide. And lastly, for this priority area, project areas describe several innovative strategies, like Dane said, technology. So incorporating dashboards, virtual technology, and automating their quality assurance to evaluate and improve their hiring, training, and outbreak response efforts. Next slide. And I'll hand it back to Dane.
Thank you, Tosin. And the last priority area is health equity. And again, kind of two parts to this. First is looking at engaging the community to pursue health equity. Things that worked well were collaborating and working with CBOs and other partners, engaging a health equity committee. Many of you already had one in place. Some of you worked to create a new one. Conducting community outreach activities and soliciting community feedback through listening sessions, focus groups, and needs assessments. And a big part of that is not only community organizations representing disproportionately affected populations, but also engaging the disproportionately affected populations directly. And we hope more of that goes forward as the community engagement efforts increase. In terms of approaches used to recruit diverse and inclusive staff, again, utilizing CBOs and other community work groups, advertising with partners, changes in recruitment and hiring practices. Where do you look for the candidates? How do you speed up the bureaucratic hiring process? Job boards, websites, again, using technology, going back to colleges and universities, particularly historic Black colleges and universities, and the old job fairs. In terms of how well staffing maps to different things that we collected data on, 73% of the project areas reported that the placement of DIS staff mapped to areas identified as high vulnerability in relation to the SVI, the Social Vulnerability Index, and the CRE Community Resilience Estimate. And that was an increase, pretty substantial increase from 59% in June of 2022. So that was nice to see. And then at 92% of project areas reported that DIS staff mapped to areas identified as high vulnerability in relation to high STD morbidity or to areas with populations disproportionately affected. And I think that's probably the most common way historically we've done it. We've tried to put people where the disease is. So what worked well in terms of health equity? Commitment to employing diverse and an inclusive workforce, removing recruitment barriers, having a diverse staff and diverse hiring panels, leveraging networks and partners, and again, back to professional development and training being critical. Challenges with health equity, those restrictive minimum qualifications that also came up in when we were discussing workforce expansion, non-competitive salaries, candidate shortage, where do you find a deeper candidate pool? How do you retain staff? Having diverse candidates and the lack of effective trainings. So that covers all 5 of the priority areas. So what were some of the main takeaways for this reporting period? Clearly, project areas continue to face challenges hiring and training staff through the end of 2022. However, they used a wide variety of methods and strategies to try to get staff on board and do the training and needs assessments that were necessary and to pursue health equity. There was significant progress across the 3 reporting periods. So again, that was nice to see. It was also encouraging that most project areas have outbreak response plans and that they reported having capacity to respond and being ready to lead. And we hope that the next data submission, which will cover January through June of 2023, will yield even higher data quality and more closely reflect progress on the DIS workforce activities. So next steps, now what happens? Of course, the elephant in the room is what happened back in June with the DIS workforce rescission as a result of the debt ceiling negotiation process. So where do we go from here? Well, we feel it's important that we continue to monitor the impact of the DIS workforce funding, particularly the rescission and its impact on you all on going forward. So a little bit of shift maybe in focus for the July through December 23 reporting period. But what you'll see for what just went out for the first 6 months of 2023 in the DIS workforce evaluation reporting template, data collected remains the same with the exception of Table B in the staffing data worksheet. And I'm going to try here in a minute to show you what that looks like. But basically, we're now asking how many DIS workforce funded positions were eliminated by June 30th, 2023. Remember, Table B was supplement funded positions. How many had you created? How many were vacant? Now we're going to ask you total number of positions, how many filled, how many vacant, how many eliminated. We're also going to ask you to project the status of DIS workforce positions going forward. So you'll see hopefully here in a minute from July 1st through the end of the original supplement funding period, 2025, we're going to ask you to project kind of the outcome or the status of your DIS workforce positions. And I'll show you that here in a minute. A last note here before we attempt to share the spreadsheet is that we on the evaluation team will be holding office hours sometime here in August, a date to be determined, and we should get that out before the end of the week. So as you begin to prepare to report by September on the first 6 months of 2023, certainly any questions or issues that you have, you can come to that office hours and ask them. Of course, as always, if you have any before those office hours or after, you certainly can reach out to your project officer. So let me see if Dane can figure out how to show his other screen. Can somebody give me a verbal that you see an Excel spreadsheet?
I see it.
Great, thank you. Okay, so this looks eerily familiar to all of you, I'm sure. This is the staffing data tab in the reporting template that just went out. And table B, again, staffing supplement progress through June 30th of this year, and then projections through January 2025. Some instructions here, and the guidance has been updated as well. So we encourage you, as always, to use the guidance in addition to the instructions that are here. So it's important to note here, you see in red, the table B includes columns B through M. So it goes well beyond what you see on the screen here. And as a reminder, please use the horizontal scroll feature down here on the right to move the table across the other columns that don't show up in the original screen. Column B is frozen, so you can see the position types, but the rest of this will move with the horizontal scroll. So here's your total positions created. You're used to seeing that. We used to ask how many of those are vacant, so you're used to seeing that. And position supplement positions created and those vacant are a subset that is added to what goes up here in table A. And you're used to doing that. This is all positions, PCHD and supplement funded. So that part didn't change. What did change is adding column F. So you've got these positions here. Column B will be total number of positions, and these three columns should add up to the total number of positions. So it's either filled, vacant, or eliminated. Then in column G, based upon what you put in these columns, it will auto-populate the number of current positions left. And then these columns, H through K, are where we're asking you to project from July 1st through the end of the project period, which is currently January 2025. We want you to estimate how many of the positions where you've already secured an alternate funding source, that you anticipate that you'll be able to secure another funding source, but that hasn't happened yet, that you anticipate will be eliminated, and for whatever reasons, at this point, you're unable to determine another funding source or if the position will be eliminated. And these columns should add up to what you have here in column G. And then one last question we ask is, for the end of the approved project period, and in addition to currently existing positions, if there's any new supplement funded positions that you anticipate creating utilizing DIS workforce funds. You never know, there may be some. So if there are, you would put those here, and then a final spot for any comments. So it seems like TMI right now, maybe. But again, we encourage you to go back, look at it, look at the guidance document, talk with your project officer. If you have questions, please ask them. And join us on our office hours sometime in mid-August. So now I'm going to go back to my PowerPoint, I think. Bear with me, folks. There we go. All right, so that completes our presentation for today. We'll now open it up to any questions that you may have about anything presented today. Let me see if I can get the. Hi, Greta. Why is carry forward funds not listed as one of the methods to fund staff through 2025? How do we want to uniformly capture this option? Good question. That's something that we can talk about internally here in the division and get back to you. You know, my guess is if you're using carryover, that yeah, let us get back to you on that. There's some nuances to that I think we need to discuss internally. Unless Jeff or Stan, do you have a response for Greta or Beth?
Sorry, Dane, can you repeat the question? It's about using carryover to continue to fund positions, or I didn't quite.
Yeah, in other words, they're not really finding an alternate funding source like state funds, but they're going to use carryover to continue to fund the position if the DIS workforce funds run out in their jurisdiction. Am I interpreting that right, Greta and Beth?
Well, I think the question is after the end of the period, so they can continue to use the funds previously approved as carryover to pay for people during the project period, but after the project period, I think they'd no longer be able to carry over DIS workforce funds. Is Jeff on? I don't know if I'm stating accurately. So maybe the clarification is just on the time reference that we're asking for after the project period is totally concluded. And right now it's set at January 2025. We're actually we're in the process of requesting to extend it for another year, in large part so that people have more time to be able to use the DIS workforce funds. Hope that makes sense.
Yeah, and if that doesn't answer your question, Greta or Beth.
Oh, and I see Greta said to fund staff through January 2025, and definitely you should be doing that. The question is asking for after January 2025, which is kind of the big question. Once the money can no longer be used, what kind of way forward do you guys see? Over.
Hi, this is Greta. I got unmuted, so I'll just say, I don't think I understood correctly when Dane was explaining that you're looking for after January 2025, what are we going to do? And that I missed that funding. So all of columns H through K is our anticipation of what will happen after January 2025 and our money is gone.
Exactly. And I know some people feel like, wow, that's far in the future. We don't know yet, you know, but I think we want to have some idea, and as the reporting periods go along, a better and better idea of what is the next step going to look like, in part for our own knowledge, and then also so we can feed that back to you, so you know, hey, there are these other project areas that have figured out a way to identify local funding, and maybe we can share information, share strategies between project areas.
Yeah, I think, again, I think that we'll have to have some internal discussion, if nothing else, just for so that we're all on the same page with that, because I think in the table as it currently is written, it's talking about through projections from July through January of 2025 as it is now, not after. But let's we'll have those discussions and reach back out either way, either confirming what's been discussed here or clarifying it. Steve mentions that the tool captures issues around staffing. However, it does not reflect cuts the program will have to make on items like testing, county health department support, surveillance infrastructure in order to redirect funds and try to maintain the DIS staff. How would this information be captured? You're right. The form does not do that in trying to keep the form manageable. Perhaps you could add some of those comments that are applicable in the notes fields, in the comment fields that are part of that form. You also can perhaps share it in your continuation applications that are coming in late August or early September, or through your project officer. But you're right, the current DIS workforce evaluation reporting template does not capture that. Beth asks, would those be considered confirmed funds if we do not have the FFR completed? Beth, could you come off mute and kind of explain what you mean?
Yeah, so currently we have an FFR in place, and the FFR takes us all the way through December of this year. So in order for us to know how much money we'll have all of calendar year 2024 into that first month of 25, we would submit an FFR in March that would say how much money we have from the previous years, and that would confirm if we have enough money for that current year's expanded authority. Because you have to ask for the expanded authority to be approved.
Okay, so that was more of a comment than a question.
Well, do we need the FFR first, or can we just say it's confirmed based upon what we think we have?
I would say, Stan, correct me if I'm wrong, or Jeff, but go ahead.
Okay.
And say it is. Again, these are going to be estimations.
Right. It's all estimates.
And, yeah. And the day after you report on this, it could change. So, but we just want to, kind of have an idea here in Atlanta, what's going on with those positions. Diana in New York says we've moved a few field positions off of the DIS grant to other sources for reporting on current status. Are these classified as eliminated? No. Those would be you found an alternate source. Eliminated means that you laid the person off and or the FTE got removed. Glenn makes the point that, Diana, if that wasn't clear, please come off mute or add another comment. Glenn, but if you were really successful in hiring, unlike us, you don't have funds to get through 2025. Yeah, that's correct. I'm not sure anybody will have burned through all of their funds. I know the burn rate varies, but I don't know if anybody will be in that position, but that's a good point. And we've got 5 minutes left. Any other questions or comments? I did want to get one announcement in before we adjourn for today, but I think we have time for one or two more questions.
Hi, Dean, can you hear me?
Yes.
Hi, so to clarify my question, so just for those columns D through G, which is on the current status, so we have a couple of instances where we've kind of preemptively moved folks off of the supplement onto other sources. So for those columns filled, vacant, or eliminated, do we count them as filled and then sort of specify our projections in the other columns? Is that what you were saying?
Yes.
Thank you.
Yeah, now remember, part of that spreadsheet is through June 30th. Now you're going to be completing this spreadsheet between now, which is August 1st, and mid-September. So we want you to try to stay within the reporting period for the first half. So what happened by the end of June, and then projecting from July 1st out. Okay. Leslie, our FFR is still in March. That I am not, again, Jeff or program team or Stan, if somebody's on and knows the answer to that, if you could come off mute and let Leslie know. Anonymous, very important aspect to capture. Programs are going to severely gut infrastructure in order to maintain staff. I would expect you're right. So you're right on that. It's just in this spreadsheet, some of that we can't capture everything, but again, going forward, based upon feedback we get from you all, it's likely that portions of that spreadsheet may look different when you go to report on the July through December 2023 report period. Okay, I think that's all that we have time for today. So before we close, let me turn it over to a fellow evaluation team colleague, Kirsty Klein, for an announcement. Kirsty? Can you come off mute, Kirsty? Are you on?
Maybe she needs to be unmuted.
Well, she's raised her hand. Jacita, can you help with Kirsty Klein? She's got her hand raised.
Thank you. Hi, everyone. So I am on the evaluation team here at CDC, and I just have a quick announcement about an opportunity coming up. So later this week, we're going to be sending out the announcements for the Harvard Program Evaluation Practicum, along with the application. So look out for an email coming from the STD Peach email account. So this is an opportunity for STD prevention and control programs, either state and local health departments or their public or non-governmental partners with support of the STD control program, who are working to improve STD outcomes that are in need of an evaluation plan and some technical assistance. So we invite program staff to come to the CDC headquarters in Atlanta, January 2nd through 5th to participate in a training alongside Harvard public health graduate students. And this is followed by a week of field work in a site visit from the graduate students. And then participants will work in teams to develop evaluation plans for their projects. So be on the lookout for those applications. They'll be going out later this week, and you can reach out if you have any questions. Thank you.
Great, thanks, Kirsty. Yeah, and past participants have found it really a useful opportunity. So we encourage you to consider, and as Kirsty said, be on the lookout for that announcement and request for applications. Okay, folks, we are about up at 3 o'clock. Thank you all again for participating today. Great questions. A couple of them will have some internal discussion and get back to you all in the field with responses either way, either confirming what was discussed today or providing more clarification. And as always, we appreciate all of you and all of the hard work you do on the ground there in your local and state programs. And everybody have a great rest of the week. Thank you. Bye now.